There's no evidence that we don't have to social distance with regards to young children. I think what a lot of people have said is that the practicalities of trying to do that in a school is going to be exceptionally difficult. But we should still try to do it. The silver lining to that is that it does seem that the preponderance of evidence suggests that the younger children are the less likely they are to spread the virus, so that you can be a little bit more relaxed about young children potentially. But there's no evidence. It's merely a question of trying to do the best that we can and recognizing that having kids maintain a 2-meter distance in schools, especially if they're very, very young, is going to be practically very difficult, if not impossible.
Okay, but let's get a clarification on that, though. You say not as much, but kids can still get COVID-19 and they can still spread it, right?
Yes, I mean, the risk is not zero. The risk is lower for younger children than it is for adults in most, but not all studies. But that risk is not zero. Kids can spread the virus. Kids can get sick. But when you look at children, and by children, we mean children under the age of 9, the risk of them transmitting that does seem to be lower. But as you point out, it's not zero. So we have to be mindful of the fact that as schools reopen, there can be some spread of virus between children.
Okay, that brings us to our next viewer then, Danielle. And she asked 2 really good questions. So we're breaking this her email to us up. And let's begin with her very first question here. She asked, what guidance can be given to parents who are sending their kids to school around proactively managing risk beyond following public health rules like hand washing, etc.? Should we watch for a threshold in daily confirmed COVID cases or estimated community transmission and pull our kids out of school before confirmed cases appear?
Well, that's actually a really good question. I don't think there's no threshold. There's no actual number. But if we start to see that in the weeks after schools reopening, you start to see the number of cases go up, and we see this upward trajectory as we saw at the beginning of the pandemic back in March. That might be a time for not just parents, but also school administrators and government officials to reassess the situation and maybe see if it's time to either restrict or close down the schools together. So it's really the upward trajectory of cases, but there's no fixed number we need to look at.
Okay, staying with Danielle, this is the second half of her email to us this morning. What are the expectations for parents when kids come down with cold, flu, COVID symptoms, since they are all the same? Does the whole family get tested and self-isolate until we have the all clear?
So yes, it's testing. If your child gets sick and there is some concern that it might be COVID, get tested. You don't necessarily need to test the whole family. You can test just the child who's sick, and then if they test positive, test everyone else. Although, of course, nothing stops you from testing the whole family. Key to that, though, is getting the test results back quickly so that you know whether you can self-isolate or go back to school. But it's clear if there's any doubt, if there's any question, get tested because that's how we're going to contain this pandemic. If we can get a lot of people tested quickly and get the results back quickly when necessary.
Okay, you talk about getting tested here, and the next question actually comes from Juliette LeMay, and she asks the following. Would it be unreasonable to have all children returning to schools to be tested for COVID-19 prior to school beginning in September? Could there be testing set up in schools for students and staff?
So testing everybody when the school year starts probably wouldn't be that helpful because you'll know you're negative on that day, but you don't know what's going to happen after that. And because schools are not self-contained environments, it's not as if it's not as if the kids and teachers are living in the school and not coming into contact with the outside world. It's not like the bubbles that we're seeing with the sports franchises. So testing people at the start of the school year wouldn't really help. It's more useful to test people who either develop symptoms or who come into contact with somebody who's potentially infectious, because that's how you're going to identify the cases early and isolate them before they can spread the virus. So it's not testing at the beginning of the year, it's dynamic testing going forward that's most important.
Okay. We have less than a minute here, but I do want to ask you, because as parents right now debate whether or not they should be sending their kids back to school, we were speaking to one parent in British Columbia over the weekend, and he is fighting to keep his kids at home because they live with his parents, the children's grandparents. He doesn't doesn't want the children to, by chance, pick up something and spread it to his older parents. Talk to us about the considerations people have to make here. I realize, and we keep hearing this argument, that getting kids socialized, again, is important. But what about the risk that children pose to extended family if extended family who are older are part of one's bubble?
Well, I think that's a very important question. So if you have somebody at home who's elderly, who's immunocompromised, or if you have a child who's immunocompromised, I think you have to realize that what's true on average for most children may not be directly applicable to your specific situation. So if your specific situation involves some high-risk feature, either the child or the close contact who would be at high risk for complications, then you have to look at the situation and say, maybe going to school isn't the safest course of action, and that exceptional measures would have to be taken into your case. So we have to individualize our behavior based on our specific situation. Absolutely.